Hello everyone and welcome to today's webinar on BEMER technology. My name is Dr. Joshua Berka, Medical Expert Center here at BEMER USA. In today's webinar we're going to be reviewing the fundamentals of the BEMER signal, applications and usage guidelines, as well as some frequently asked questions. With that being said, I would like to start with this disclaimer here. BEMER products are in no way a substitute for professional medical care. There's no medical claims being made from the use of these products, and statements have not been evaluated by the FDA or other government agencies and are not intended to diagnose, treat, and/or cure any medical conditions or diseases. You should always consult your own physician and/or primary healthcare provider if you have any medical concerns. BEMER products are wellness and fitness systems, and all information presented in this webinar today is for educational purposes only. Excellent. So what is BEMER intended to be used for? BEMER therapy is intended to be used to enhance the general blood flow. And by enhancing the blood flow, you support the body's nutrient and oxygen supply as well as waste removal. This enhances cardiac function, physical fitness, endurance, strength, and energy. BEMER is also excellent for prophylaxis or prevention. As you increase blood supply to various tissues, especially the brain, you can support and enhance concentration, mental acuity, reducing the effects of stress, and further supporting relaxation. BEMER also has a sleep program which helps with the circadian rhythms, the natural circadian rhythms, for those individuals who wish to have help managing sleep. So our body works most effectively when we have the nutrients, when we have the oxygen delivered to the cells, and the waste products, these metabolic waste products, are properly removed. And this all occurs due to a healthy cardiovascular system and, of course, a functional circulation. When this process becomes disrupted, disease or dysfunction manifests or occurs. BEMER is the most researched PEMF system on the international market, and so many people want to know or understand, how is it that this works? Why is this the case? And it all starts right here. The fundamentals of BEMER's effect comes from the unique waveform or signal that it uses. The BEMER signal was created back in 1998. And as you can see here, this is the mathematical formula that gives rise to this unique, multidimensional, complex sinusoidal waveform. Its effects, though, on the left side you can see an example of different waveforms which have been utilized in the past by traditional PEMF devices. You have the sinusoidal, trapezoid, triangular, sawtooth, and double sawtooth waves. But their pulses only reach a certain segment of cell frequencies. Notice on the right here the broad range of the BEMER's waveform. And this unique waveform has 5 international patents and reaches millions of cells within the body. When comparing these various forms, you can see even the most complex wave on the left side has maybe 300 stimulations per second versus BEMER's 1,200 stimulations per second. That means more signal to more cells, more effect. In addition to the signal and waveform, the BEMER has a unique electromagnetic field distribution which enables the BEMER to affect multiple cellular processes simultaneously. And while BEMER does exhibit multiple effects, the BEMER's PEMF, the electromagnetic field, has a profound effect on the system's the body's systemic circulation, or what we call hemodynamics, blood movement. And how exactly is this happening? The waveform or the signal is one aspect, but the manner in which this is delivered through timely variation is also very important. And the frequencies that BEMER deploys to positively affect the blood flow through the body are 10 and 30 hertz. The 10 hertz ultimately affects the larger caliber arterioles via direct nerval effect, and the 30 hertz affects the smaller caliber arterioles through the stimulation or production of nitric oxide, or NO, which, as we know, is a vasodilator. Therefore, the BEMER displays its effect through a neuroendocrine mechanism of action. The BEMER comes in a couple different models here. These two models are the professional, as you can see in the front, and the classic models. These are the brains of the BEMER, the BEMER box, or also known as the B box. And the first and most obvious distinction between the B box Classic and the professional is the touchscreen interface on the Pro system versus that of the Classic, which has raised interface buttons that you can physically touch. On each system, you have levels 1 through 10. You have programs 1, 2, 3, as well as sleep programs. For instance, on the Classic, S1, S2, S3, that can be set for 6, 7, or 8 hours for the sleep program, respectively here. And for the Pro, you have programmable timing that you can utilize for the sleep program. A lot of people always ask as well, what is the frequencies that a BEMER uses with the AC current? Well, BEMER is plugged into the wall. When it's plugged in, it uses an AC current, and that AC current, or alternating current, is converted to a DC current, and then that is used to drive the BEMER signal with the 10 and 30 hertz as we discussed. As we know, as I discussed before, the BEMER patented waveform uses a complex sinusoidal proprietary combination of 10 and 30 hertz to stimulate optimal blood flow and positively affect systemic circulation. Important to note also that the BEMER switches polarity about every 2 minutes so that the body does not accommodate to a unidirectional field. The BEMER Pro comes with a B body, the B grip, the B spot, the B light, and the B pad. The BEMER Pro is by far the most diverse BEMER system available on the market. It can control and run any combinations of 2 body mats, applicators, whether they're different or the same, and or applications of 2 B bodies simultaneously operated. And you can do this together or controlled independently of each other using either a selected level or a program. For the professional system, you can even program your own programs into it. And it's these unique features which is why many home users and practitioners, they make the choice to buy the professional and utilize it either in a home healthcare or a clinical setting. Also, it's good to note here that the B body, the B spot, the B pad, and the B light may be used simultaneously with each other with the professional model. I'm going to say this again because this is a very big distinction between the two. So if you're utilizing this and you want to be using the B light or B pad with the body or other applicators together with different or the same programs, then the BEMER Professional is the system that you should choose. The BEMER Classic. The BEMER Classic comes with a B box, the B body, the B grip, and the B spot. And while there are 2 magnetic connectors for both the BEMER Classic and Pro, the Classic can only run 2 body mats simultaneously on the same level or program, but cannot run 2 of the same applicators or 2 different applicators simultaneously like the professional system. Whether using the Classic or whether using the Pro system, it's really quite simple. Lie down or lay back, sit down, you select an intensity or a program, push the start button, and relax. It really is that simple to use. The 2 complementary applications of BEMER are 1, the general improvement in circulatory parameters. So it has systemic effect, and this is accomplished with the full body applicator, the B body, and it should be the basis of every single application. On the second aspect, use of the special applicators according to one of the 10 intensity levels, or ideally the 3 programs, for superficial up to deep localized effects, and this is more of an adjunct to the general therapeutic effects of the B body. So as I said, the B body, according to the basic plan, which we will discuss here soon, is the foundation for every form of therapy, for the general improvement of the circulatory parameters as well as other therapeutic effects as well. The application depends on the individual. There are no programs or protocols for this disease, this condition. BEMER does not use any protocols for any specific disease, as BEMER is a Class 1 FDA registered device. So it's important to understand that the application depends on that unique aspect of the individual. Application should be twice a day plus the sleep program. And in cases of acute situations or acute injuries, more than a single application can be indicated, and usually is. It's important to know that the therapy should also build from lower intensities to higher intensities, and the more impeded someone's circulatory state, the lower the intensity that should be applied, especially initially. The metabolism of people who are elderly or sick or suffering from other conditions really has to be taken into account, because these individuals can be compromised, and therefore you should not overstress their bodies. So the general full body therapy, the full body application is carried out with the B-body, and this follows the guidelines of the basic plans, and this is outlined in the user manual. As soon as someone gets a BEMER, you should absolutely invite them to read the BEMER user manual rather than just jump and start using the BEMER. It's important to understand the equipment that is being used. And this basic plan is designed to improve the general circulatory parameters and support the requirements that are necessary for metabolic processes and self-regulating mechanisms. As I said before, you can use additionally other applicators either simultaneously or after the B-body, and you can even do the B-body in successive applications. This is the B-body right here, and it's rolled up, but when we look at this unrolled, you can see here this young lady with the child. The BEMER has 4 coils, and 4 are located in the upper torso and 2 long ones in the lower area of the legs. And while these effects of the BEMER signal configuration, they've been scientifically proven and they're essentially pretty much independent of external influence, it's still important to follow some of the guidelines we're going to talk about here to really optimize your personal results. I've been using the BEMER for a long time, and while I've not heard of any negative effects, I usually will have my patients remove credit cards and watches before the BEMER. I always tell them make sure you're in a comfortable position. Avoid wearing tight or constricted clothing. You should always choose an area or a room with comfortable temperature. Avoid stress or distraction. Turn your phones off, turn the television off, and so on. The other thing, you should abstain from coffee or tea or anything with caffeine in it before applications. You should also refrain from smoking cigars, cigarettes, pipes, chewing tobacco, or even nicotine gum, for example, before application. Something you should do before application is drink a glass of non-carbonated water, mineral water, spring water. You should do this before and after the application, because proper hydration really is vital to not just your life and essential to your health, but it will help support the clearance of metabolic waste through the body. You can see this individual here lying on her back. While it's best to lie on your back when using the B-body, you can assume any position of comfort that really suits you. And the goal here is to have the most surface area in contact with the B-body as possible. Here's a good time to bring this up as well. If you look here, you can see the B-box, as I said, the brains of the BEMER. This is not plugged in to a power outlet because this one is running off a lithium battery, which is an optional addition to the BEMER, and it's really an excellent way to stay mobile with your BEMER system. So again, you can lie on it in any position you want. You can lift your knees, other parts of your body. Sometimes people stretch on the BEMER. But it is important to know that the electromagnetic field decreases in intensity or flux density exponentially with distance. So to make it simple, if you move further away from the source of the field, the less the signal strength you'll receive. And with that being said, there's many times that I will use the BEMER on my treatment table clinically while maneuvering a patient around using other physical modalities or other type of treatment applications. So whether you're just relaxing on your BEMER or reading a book, you're still getting the benefits of its application. The intensity levels, as we're going to go through the basic plan here, are set up in this way. Level 1 or 2 has more of a calming and relaxing effect, and I generally recommend that everyone starts on these lower levels. Levels 3 to 6, this is really following the basic plan, and this is for most individuals. 6, 7, 8, these are for my top athletes, people who are in excellent physical and mental capacity, younger individuals, and 9 and 10 levels, intensity levels. These have the most penetrating effect. I'll also say that more is not always better in this case, and most of the research studies have been done within the parameters, within the intensities of that basic plan. Speaking of the basic plan, here it is, and this is outlined in the user manual. Basic plan application with the B body should generally be carried out twice a day, and only after the second cycle or after 6 weeks, starting with 1 time per week, the sleep program can be gradually introduced. And you can increase the treatment by once a week application. This procedure here with regard to the sleep program is also recommended for long-term BEMER users. Even if someone's been using the BEMER for a while, it's not recommended, and when I say using the BEMER, meaning here or there, it's still recommended to follow the basic plan. New users certainly using the sleep program. If you're not up to using the sleep program, you can use level 1 without the plus signal during that first cycle before going to sleep. And again, level 1 is very low, 3.5 microtesla, no plus signal. And again, that can have a very relaxing effect for people just before bed. The first cycle of the basic plan lasts 6 weeks, and the following cycles are only 4 weeks. You should begin with level 1 and increase each level per week up to level 6, and after that 7th week, begin a new cycle, returning back to level 3 as outlined in this diagram here. So there's 2 complementary applications. One is the general improvement in circulatory parameters using the B body. Number 2 is using one of the special applicators according to one of the 3 programs or one of the intensity levels, either to go superficial or to deep localizing or focal regions as an adjunct to the general therapeutic effects of the B body. Looking at the special applicators or the second application, these are designed to penetrate into local regions, and there's different applicators for this. The B spot, for example, is more of focused areas, it's smaller. The B pad is very versatile, long, flexible, and it covers larger areas. The B sit is also a comfortable seat, and we're going to go through all of these in a few slides here. This is more of a focused region, but larger than the B spot, and of course the B light is for superficial regions, and this is the phototherapy aspect of the BEMER. While it's generally recommended to use the B pad, B spot, B sit, these special applicators after the B body, they can be used during the application of the B body. Also note that these are excellent if you don't want to carry your full body mat with you when traveling, or if someone is an ambulatory and they can't move around, handicapped people. These are great to bring with you if mobility is what you're seeking. The local penetrating effects of these special applicators, these are created in targeted areas using either the spot, the B pad, or the B sit. Again here, note that the magnetic field decreases to the second power of distance. So the further away you go away from the BEMER, the less the power is. And therefore, these coils in the applicators were configured stronger than the ones in the B body. In general, 3 different programs were developed for varying these penetration depths. These are Program 1, Program 2, and Program 3. And keep in mind that these levels can also be used with or without the plus signal with the applicators. Program 1 is levels 2, 3, and 4, using 2 minutes level 2, 2 minutes level 3, and 4 minutes level 4. These are for more superficial applications, maybe if you're trying to penetrate through the hands or the wrist. or other areas. I mean, even in the chest, if you put the B spot and you use a level 3, which without the plus signal is 30 microtesla, that is plenty of flux, plenty of intensity to go through the chest wall, chest cavity. Program 2 is 4 minutes of level 2, 3, 4, and 6, totaling up to 16 minutes, and a 20-minute program, program 3, which uses levels 6, 7, 8, 9, 10, which has the deepest penetrating effects. The average maximum flux density or intensity of BEMER signal with the B spot, the B pad, or the B sit without the plus signal is 100 microtesla. And when you turn the plus signal on when using them, the maximum average flux density is 150 microtesla. And keep in mind, these values are on the maximum level of 10. The same is true with the guidelines for the special applicators. The programs are fixed sequence of increasing intensities, as we discussed in the previous slide. The intensity levels are fixed intensity over time, 8 minutes, unless you program them. And the goal is additional local effects, and this is achieved by applying these applicators to individual regions. And these localized applications are to support the B body and its effect on systemic circulation, as well as the local application directed towards target tissues. The B spot's a small applicator, and this connects to the B grip, and this can be used for smaller regions, smaller applications. You can either use it by strapping it on to a region, like you see this gentleman has the B spot strapped to his arm, or you can physically hold it in place, and this can assist in the delivery of the BEMER signal to the desired target tissue or area. The B pad is one of my favorite applicators, and its flexible multi-coil delivery system delivers the BEMER signal over a larger region, and it can be wrapped. It can ultimately be used by lying on it, sitting on it. You can drape it over a region, as you can see here. This woman here, you can see, is lying down, draping the B pad over her leg, and there's 3 coils that are in the B pad, evenly spaced apart, when it allows you to move the signal or the wave directed towards larger regions. Many times I recommend wrapping the B pad around someone's waist or orientating vertically up the spine to support the optimal blood flow over these larger regions. The Velcro strap that's with the BEMER pad, it's a really great feature that allows the user to fix the B pad in place, and it also enables for mobility when it's active. There's some times where I'll be using the BEMER with an individual, and I'll be having them stretch, move, breathe, and it's very nice to be able to have this thing, the pad actually able to stay on the individual so it doesn't fall off using the Velcro strap. The B sit's nice. It's a soft, comfortable cushion, has a single coil in the center, and the B sit, it's excellent for those people who sit a lot at a computer chair or someone who's ambulatory in a wheelchair. It's also great for portability when someone doesn't want to bring the full body when you're traveling. And over here on the right, I'm taking a look at this. I'm not advocating at all sitting slouched like these images on the right. In fact, rather sitting at your computer should look more like this. And this is a good time. I want to bring this up because ergonomics at the workstation is one of the single most important parts of whether someone leaves work in pain or discomfort, how much energy that takes to be at work. And if someone is using the BEMER and, for instance, they have low back pain or muscular tension from using a mouse or a computer, the truth is you are not going to get changes in this situation if people don't change their work environment. And that goes across the board, not just for ergonomics at work, but for lifestyle. BEMER is an adjunctive support to individuals' lifestyle choices. The B Light is the only phototherapeutic applicator that the BEMER has available. It's an extremely bright light. It's a light-emitting diode or an LED and emits a pulsating monochromatic red light with a wavelength of 660 nanometers. And this makes the B light an ideal supporting application for helping with healthy skin as well as supplementary aspect to cosmetic applications. The B light complements the user's benefits of the BEMER therapy by means of something called photobiological or photochemical light mechanisms. And through this light effect, the B light promotes the regeneration processes of the skin. I found the B light to be really helpful for many dermatological conditions that I see in my clinic over the years. And it's also great if someone's had post-surgical procedures and they're trying to help eliminate or diminish scars. You know, while the B light's been a superb clinical tool for me, many people use the B light for its cosmetic anti-aging effects to help tighten the skin, help support reducing wrinkles, dark spots, as well as strengthening the underlying collagen. And this can help give a youthful glow and really help enhance the suppleness of the skin. As you see here, it's always recommended to use the protective goggles that come with the B light standard when it's being used on any part of the body. It's also important to note here that the B light must be used directly over the skin. It will not penetrate or have an optimal effect if the skin is covered with a bandage or through clothes. It does have to be in view of the target tissue and not necessarily right in contact, but as close as possible with no barriers in between. BEMER's also included something called the BEMER scan or the B scan, and it's located on the back of the B box with both the Classic and Pro sets. The B scan here is integrated into your BEMER box, and it's designed to check the BEMER devices along with safety precautions for the proper function. That's what they do. This makes the multidimensional BEMER signal configuration audible so you can hear it. And it's also ideal for when you're displaying a demonstration tool for interested individuals, because when the device is switched on, you press the button. This gives an audible sound that detects the electromagnetic signal, and the BEMER scan, B scan, automatically switches off after 10 seconds. Like I said, the BEMER scan, the B scan, is excellent for demonstrations either with individuals or in group settings, but it's not in no way form a diagnostic or a treatment device. The only thing that B scan does is it checks to see if the EMF is being generated by the BEMER. It can be used with the B pad, the B mat, the B spot, the B sit. All applicators except the B light, which does not use a pulsed electromagnetic field, actually uses the 660 nanometer LED monochromatic red light. I want to talk a little bit about the sleep program. But before I do this, it's important to know what's happening in the circulation throughout sleep and wake cycles. We have diurnal variations in our sleep and wake cycles, and these are governed by circadian rhythms. Melatonin, cortisol, these shifts play a vital role in maintaining homeostasis and health. And it's one of the biggest issues for a lot of my patients is they don't sleep well. BEMER recognized this and created the sleep program to help support individuals who are seeking a more restful sleep. The regeneration process is mainly occurring when you sleep, and it's considered a very important aspect, especially for people in rehab, elderly, people very susceptible to infections. In fact, a lot of times being asleep is more important than the waking hours for people trying to support regeneration. So the BEMER sleep program helps generally increase the effect of the daytime use or the active. It can help with the immune system. It can actually support the regenerative aspects or restorative processes of the body, and help to clear out the excretion of waste products, an acidic substance from the body. Very simple. It uses level 2. Instead of using the combination of 10 and 30 hertz, it uses just the 10 hertz. And it's on for 2 hours when falling asleep and on for 2 hours when waking up. Whether that's 6 hours, if 8 hours you sleep, it's the same. And it's enough to bring and support the body to bring them into a deep sleep and help gradually bring someone out of sleep in the morning in the 2 hours before waking. So the BEMER does have an outstanding spectrum of effects, and it really changes the characteristics of full body circulation. BEMER works to improve concentration, mental acuity, reduce the effects of stress, stimulates better blood flow through the entire body, and assists in the clearance and disposal of metabolic wastes. BEMER promotes relaxation. BEMER supports cardiac function, enhances physical fitness, endurance, strength, and energy. The nice thing about BEMER is it's effective for long periods of time, has virtually no side effects, and is very easy to use. The frequency of application is based on the user's available time and the therapeutic requirements. You can certainly use more than one application spread throughout the day. That's considered optimal. And in an acute situation, you can do multiple applications, which can be beneficial. I want to sit on this slide for a second so you can understand what's going on here. This is the start low and go slow slide. The older an individual, the more affected or impeded their circulatory state, the lower the intensity, not the higher. More is not better here. So always start on the lower levels and work up. The goal of the applications here is to activate as many blood vessels as possible, enhancing the systemic circulation and supporting cardiac function. And most blood vessels are located superficially, so the B body is that primary cornerstone application that should be used and started with. The more severe the metabolic state of the user, the lower the level that should be applied. And the goal of each therapy is the improvement of metabolism. Therefore, begin at these lower levels and work up, increasing in intensity. I want to go over a few of these frequently asked questions, and these are available in your BEMER back office in BEMER.net. And these are updated all the time, so if you have one from a year ago or 6 months ago, you might want to download the newest version. These FAQs are set up and they're split up into basic statements, user questions, technical and physical questions, and the field targeted to BEMER, from unspecific electromagnetic field therapy to specific targeted BEMER application. And of course, the fifth category in the index is BEMER in sports. How can the nature of BEMER therapy be briefly explained? This is in the basic statements, and we talked about this. You know, BEMER is designed to improve the overall circulation by supporting the body's self-regulating mechanisms. The blood is the manner in which oxygen and nutrients and chemical messengers, as well as the immune cells, are transported throughout the body, and this is through the blood. And only when our cells, our tissues, our organs are adequately nourished with these nutrients, with oxygen and carbon dioxide and metabolic wastes are removed, that's the only time we can be productive and our body function healthy. The optimal regulation of circulation is a prerequisite for ensuring good levels of health and fitness. Without proper blood flow, it's very simple, you cannot be healthy. Next question, it says, why is proper circulation so important for a person's well-being and physical performance? For me, it's quite simple. I mean, if you don't have raw materials being delivered to the tissues that are needed, that metabolically need this, then there are mechanisms that can compensate, but ultimately not for too long. We can go a long time without food. We can go a long time without water, but you cannot go a long time without oxygen. Your body needs oxygen. Your cells need oxygen, and it needs the capacity to be able to remove metabolic waste products so it can function in the most optimal way. Here's a question that I get probably the most often. Which diseases can BEMER cure diseases? BEMER is not a disease-specific application. And its effect on circulation and the resulting improvements that you get to the supply and removal of the substance throughout the body This allows the cells to increase both the production of energy as well as the regulation of energy. And without energy, cells cannot carry out their tasks. So energy is very important, and fundamentally, mitochondrial bioenergetics, or ATP, is needed for all cellular processes. Therefore, energy is an important aspect. Many people forget BEMER is an acronym for Bioelectromagnetic Energy Regulation. Can I use BEMER with metal implants, or should I consult my doctor first? I put these two questions together because they're very related. BEMER can be used with anything that's in the body: sutures, surgical screws, titanium plates, mesh. It can also be used with people with electric or electronic implants, deep brain stimulators, insulin pumps, and other implantable devices, defibrillators. While BEMER cannot be the ones to say, yes, with your device you can use the BEMER, instead what you should do is you should check with the manufacturer, contact the manufacturer, let them know that you're using a device with the highest output level, a maximum average flux density or intensity of 150 microtesla, and will this have any adverse effect on the implantable device that you're using? I can tell you this date, year to date, today, mid-October 2015, there's not a single device produced here in the United States that I'm aware of that has any counter effect with using the BEMER. Another question that I get often asked is, are there any side effects using the BEMER? Side effects are understood to be allergies, bleeding. To date, no dangerous side effects have been detected with long-term applications. However, and I want to go through this, I have had individuals say, you know, I have had cramping, or my skin feels itchy, or I feel some myalgia, foggy thinking, more pain possibly. The cramping a lot of times comes from lack of minerals, magnesium, calcium, or other mineral deficiencies, and this is one of the reasons I absolutely have individuals using the BEMER have a glass of spring water, mineral water, both before and after, and ideally drinking this throughout the day. Same thing with the skin reactions. Generally, it's lack of water. Now, if someone is getting more pain or discomfort, this can also be, for instance, when I've worked with patients with nerve pain, I always say, okay, this is good, the body is responding to this, however, let's back it off. If someone's using level 5 or a program 2, then go to a program 1, or decrease the level. I'll say again, the power is not as important for supporting the self-regulating process, supporting the circulatory process in the body, as one might think. Even the lower levels have great results. However, if there are new symptoms that are occurring in connection with BEMER therapy, they should be diagnosed by a physician. Don't utilize the BEMER as something, oh, I've got this going on, this will help with everything. BEMER is a wonderful adjunct for both a clinical setting or a home healthcare setting. But any symptoms that are coming up really should be looked at and diagnosed by your primary care provider or a physician. How is BEMER applied? We just talked about this. Twice daily application, followed the outlined basic plan, is the fundamental basis for the systemic support of circulation, followed by using one of the special applicators, B-spot, B-pad, B-sit, or B-light. How soon can results be expected? Everyone wants action now. This is nothing new. However, we have to look at the aspects of how long did these chronic ailments, conditions, diseases, the situation you're trying to work with, how long did it take to manifest? A week? 2 weeks? More like 1 year, 5 year, 10, 20, 30, 40, 50, 60 years of development. So you have to give the BEMER a chance to help support the body. However, generally what we found, individuals who are in moderate to good health have some level of effect in a 4 to 6 week window of using the BEMER on a daily basis. and of course longer times for individuals with more chronic health concerns. Nothing changes. The BEMER is most effective when the basic plan is followed consistently and regularly. The other question I get is, how long does the BEMER effect last? These are 3 generations, but I really want you to pay attention to the lighter color, which extends all the way through time on the left, up to 12 hours. And the changes in characteristic are the intensity, up to 25–30% increase in the blood supply. Effects can last 8, 10, 12, 24, up to days, depending on your level of health. Someone who's in a more chronically ill situation needs to use the BEMER just like a medication, just like a supplement, and they need to dose this on a daily basis, twice a day ideally. The newest technology of BEMER delivers more stimulus, scientifically proven frequencies, uses a patented timeline, and also includes the pacemaker signal, which is known as the BEMER Plus signal. The best way you can ensure that this BEMER therapy works for you is support your body on a daily basis. BEMER, again, is a lifestyle modification, a lifestyle choice. Making sure you're drinking plenty of water, staying hydrated, eating a balanced, nutritious diet, staying away from the things that you know can adversely affect you, and movement. Movement. You should do an average of 3 to 5 days a week, at least 30 minutes per day of movement or exercise. And if you're an individual who can't do that, you can even stand in one place and do exercise. But that commitment to movement externally is as important to the commitment that BEMER supplies internal exercise through its effect on the circulatory system. Moving into the technical and physical questions, I'm not going to jump through this too much, but the first question is, what is BEMER? We've been through that. Why does the BEMER's magnetic field permeate the body? Electromagnetic fields are miles long, kilometers long, and due to these long wavelengths, they permeate all matter. That includes bricks, that includes stone, including the human body. There's nowhere in the human body, regardless of how thick your skull is, how large your frame is, that the BEMER cannot penetrate through and have a desired physiological effect. As I said before, the electromagnetic field weakens quickly, increasing distance, and it loses intensity, so you should be in contact with the applicators or the bee body. Another question I get is, can you overuse the BEMER? Can it hurt me? Can I harm myself? The BEMER is not going to hurt you. It supports the body's self-regulating mechanisms, which are innate, which are natural. However, it is important to follow the recommended guidelines, the basic plan and the user manual, following the appropriate levels. These intensity levels are based and used on desired depth of penetration, and they're not necessarily reflective, as it says here, of overall effective BEMER therapy, which I've said over and over. We have to get this out of our mentality that more is better. Not the case here. In fact, for some people, more sensitive, these lower levels can be more effective than even the upper levels. I said it before, BEMER is currently the most developed form of application of PEMF in the conventional medical market. Its unique impulse, patent protected, has a wide frequency system as compared to when you're looking at other type of impulses. And important to note here, the electromagnetic field that BEMER uses only serves as a carrier substance and transmitter for the signal, the BEMER signal. And that's what's responsible for the effects in the body, not the field. The field, of course, you're going to have an induction effect. Any electromagnetic field creates an induction effect. But the unique effect of BEMER is directly related to the waveform, the frequencies, the manner in which those frequencies are delivered through a timeline, and the applicators and how they're delivered. I mentioned this plus signal. What does the plus signal mean? And the plus signal is integrated here into the normal base signal, and this helps the individual to use the BEMER application with more additional stimulation. it's important to use the plus signal when you're trying to create this pacemaker, trying to ultimately reset the body into a more optimal blood flow or hemodynamic picture. Plus signal is used every 20 seconds. So every 20 seconds, so if you're using a level 1 with the plus signal, it will use 3.5 microtesla, and it will increase every 20 seconds up to a 10, and then drop back down. Just like my voice is not a monochromatic voice, or a monotone voice rather, and there's tonations that move up and down. This is what the body responds to most favorably in nature. Nothing is static. We live in a dynamic world, and it's this pacemaker, this plus signal, that enables the unique long-lasting effects of the BEMER signal. A lot up on your screen here, but again, these are in the BEMER net. This is in your back office to download, and you should have these for people who are interested in inquiries to understand more about the BEMER, or for new users. I'm just going to note here, it says that according to the user's information, there's certain diseases that should only be treated by a doctor who's familiar with BEMER. And why is this? For instance, unexplained fever. Fevers are not a disease. These are a defensive reaction. These are a symptom. But the cause of the fever really should be identified or diagnosed by a doctor, clinician, physician, because the fever is the body's response to infections, and we have to know what's causing this rather than just use the BEMER and say, oh, you'll be fine. It's good to know what the underlying cause of condition is. Individuals with severe cardiac arrhythmias, these can be life-threatening, and the cause of the arrhythmia should also be identified. Also, whether they're on medications. BEMER, again, is not going to cause arrhythmias. It's not going to cause any of these problems, but as an adjunct with anything. For instance, if someone had cardiovascular issues, you would also check with your doctor on the type of exercise you're doing. Fast burst, slow switch, fast twitch, endurance training, strength training, and BEMER should be looked at in the same manner. Individuals with major aneurysms, they should be cleared for use by the individual doctor that is working with the individual. Also, non-pharmaceutically compensated seizure disorders. This means not anyone who has seizures or who's epileptic, they shouldn't use BEMER. This certainly can be. But if they're not controlled pharmacologically by this, then they should ask their doctor, yeah, do you feel like it's okay if I use this device? This is also true with psychoses and schizophrenia. Not that they cannot use the BEMER, but if they're not being managed by a clinician and not being managed by medication to help control these things, then the doctor should be involved in the usage guidelines for this as well. This is a great time to bring up contraindications. The only contraindication for BEMER use is if an individual who has had stem cell and an organ tissue transplant and are also on immunosuppressive medication. The contraindications that apply to other devices like metal implants, pregnancies, they do not apply to BEMER. And I said before, for electrical implants, it's important to refer to the thresholds recommended by the manufacturer, letting them know that the maximum average flux density with the applicators is 150. And those values are associated with the maximum intensity on level 10. Looking at BEMER in sports here to finish up, what influence will the application of the BEMER have on my endurance? Well, if one can train more, that increases the scope and their ability to have more intensive training sessions. That supports endurance and increases your ability to train more and perform in a more optimal manner. Someone who's a sportive person may say, I have muscular tension, can I use the BEMER for condition? And I combined these 5, 2, 5, 3 here. It also says which level should I select after intensive stamina training, competitions, and is there a difference in recurring before and after? And these are good to combine together. Regardless of the application, the basic plan should be followed. That means the whole application of the BEMER body. In addition, local applications, say someone's working a certain region of their body, shoulders, legs, low back, you can use one of the 3 pre-programmed programs to direct to the inspected areas. In general, using something like a level 3 with the B body after intensive training sessions, this is really the most sensible option here. And it ranges. I usually recommend levels 1 through 5 kind of as a cool down, like an individual stretching or breathing after a high intensity exercise. Before the training, higher intensities can and should be used. Levels 5, 6, 7, program 2, program 3. And this can be used before training and or before competitions or events. After sports injuries, if you want to minimize swelling, support recovery through BEMER supporting circulation, a lot of people ask, will the swelling increase? BEMER supports the body's own processes. The swelling is not going to increase. In fact, BEMER is going to help decrease the swelling over time by moving the blood through the area, bringing in the new materials, and clearing out damaged tissue or waste products. Therefore, that inflammatory process can close or complete itself to move into the regeneration phase of healing. And finally here it says, is BEMER a legal means of performance enhancement or doping? And of course the answer is no. I have many professional athletes that I see individually, and there's many professional athletes out there who are using the BEMER. The BEMER supports the body's own processes. Of course you're going to have more blood flow, you're going to have more oxygen, more nutrient delivery to the cells in metabolic need, but this is not something that is illegal. It's actually something that is going to enhance performance, enhance recovery, and ultimately support good quality training as well as recovery and performance. Well, thank you for listening to today's webinar. My name is Dr. Joshua Berka. The BEMER user hotline is available for application and user guidelines for individual specific cases, and that number is 310-295-9753. Hotline hours are listed on the call, so please only utilize the hotline within these hours. Thank you very much for your attention today.